Hello, everyone. Thank you for joining the Waste Watchers in Cornwall Primary Care Climate Resilience and Health Creation meeting for today. I'm stumbling a little bit because this is a re-record. Last week we started and had a few technical issues. So this is a re-record. So I will go straight into what we're doing today. So we're focusing mainly on gloves reduction in primary care and then a little bit on our online resources on the new website and then a brief visit to blister pack recycling, which is always a popular topic. So the first bit is the story so far of the gloves reduction. So back in January, we had some visiting speakers from the IPC, the Infection Prevention Control Team, and we spoke in depth about gloves reduction and recognised that a lot of the pilots in glove reduction were in secondary care and not so much done in primary care. So what we had then a follow-up meeting with Trudy Isherwood, who's from NHS England, Honey Smith from Greener Practice, and Ian Vinnell from the IPC in Norfolk and Waveney. Now, Ian had done a pilot very similar to what we're doing in Cornwall. So basically, we've got all the resources from Ian. Thank you very much, Ian, and updated them for Cornwall. I then tweaked it and presented a summary of what we were planning at the Supporting General Practice meeting. And we've got so far 7 practices in Cornwall that are at various stages in the glove reduction pilot. So we're really pleased with how it's going. I want to share a little bit today, but also want to reach out to say it's not too late. There's plenty of time. This can obviously be done at any time of year, only takes a month or 2 really. So I'll go through kind of the story behind it, why we're looking at glove reduction, and then I'll briefly explain the pilot and how it works. So why are we looking at glove use at the moment? It rose through the pandemic, and bearing in mind that some people would have now been trained or started practicing through the pandemic, and it became a new normal. So it's kind of a bit of a reset, and we're really pleased that the Infection Prevention Control Team in Cornwall and the Isles of Scilly are completely supportive in what we're trying to do here, and they are helping us to get that right message about when gloves should be worn and when it's okay to not use gloves. There's a huge cost, financial cost, but also environmental cost. It's not just about the production of the gloves, it's also about disposal of them because it's often at high temperature incineration because they often go into clinical waste, obviously. So it's a good time to just do a reminder. So when Ian in Norfolk and Waveney set about doing this pilot in his area, he chose 3 Norfolk GP practices back in 2023, and they also looked at what has been learned from hospital trusts, but into care homes and primary care as well. So I'm not going to read through all of this. You can obviously look at this in more detail and slow things down if you want to, but this is a summary of what was done in Norfolk and Waveney, looking at reducing the amount of gloves. And there weren't aiming for hundreds and hundreds. It was a small number that they tried to reduce. So just asking practices to reduce 5 pairs of gloves a week. That was their aim initially, and they found that it was very successful. They went through this process, an online questionnaire. Questionnaire was completed by all staff, not just the nurses that are renowned for using gloves more day to day. They looked at the data that came out of those questionnaires. They put together some training, and then after a few months, they were revisited with another questionnaire to look at how things had changed and again to just sort of learn from that whole process. There was great learning from it, very, very positive. Staff perceptions of glove use had improved, showing that questionnaire, looking at that questionnaire after they'd done the training. So a few examples here of when gloves had been worn inappropriately before they'd done the pilot and the training. It was things like taking a patient's pulse or blood pressure or temperature. Some people were using them typing on a keyboard, giving a vaccine and taking patients' weight. So this is where in Cornwall we can assess and look at what comes out of the questionnaire to really focus and raise the right discussions and target the training and the discussions. And one practice in Norfolk and Waveney reported a 4,500 glove reduction usage in the 3-month pilot period. So there's huge savings, obviously financial, but also the carbon reduction in that. So really, really positive results, which is why I have basically stolen what Ian did and made it right for Cornwall and checked it with the Cornwall and Scilly IPC team, Infection Prevention Control team. So this was about changing perceptions of both patients and staff, because I think as patients, we sometimes expect that glove use is important to keep us safe. But it's reminding and revisiting hand hygiene and hoping that people can be reassured that that expectation is not there in every scenario, and that gloves are not a substitute to good hand hygiene. So self-protection is one area, but also being aware and trying to protect patients is obviously another driver why people or maybe get into habits of using gloves more and more. So this was really positive. We learnt from Norfolk and Waveney that it was really positive learning and discussions that came out of that training. There were other resources produced that we have access to. This is a national resource that anybody can use. It's got the NHS logo on it, and other logos can be added if you wanted to make it bespoke to your practice or your specific team. So it could be with GPs, nurses, any contact with patients, and it's raising awareness. So these are designed for either using for patients. So in waiting rooms, there is a screen available for the waiting room if you've got a TV screen with adverts and so on. But also they can be displayed in consultation rooms or in staff areas, again, about the reminding and raising awareness. So we've got all these resources. We can share these with any practice that wants to have the resources, and we can help support you to amend and edit them as necessary, but it's all free. So the plan for primary care in Cornwall and Scilly in terms of glove reduction is a very simple 5 stages. First of all, send a questionnaire. So we make it a bespoke questionnaire for your specific practice, and we set a short time period of a couple of weeks so that we try and get people to do it really quickly. It takes 2 or 3 minutes to complete that first questionnaire. It's just a quick, when do you wear gloves? Yes, no. And then following on from that, we do some training. Now the training can be done in-house within your own teams. We provide a PowerPoint that you can go through yourselves, or we're very happy for one of the team, one of the project workers, so myself, Martin or Catherine can come in and support you with that to help manage the discussion and talk through. But the idea is that all staff complete that training. Now, I know it's hard for all staff to come together, but sometimes maybe on practice closure days, we can assign just half an hour to an hour of that for that training. After the training or alongside the training, posters can be displayed, the ones that I've shown you. And then after the training and after a short time, maybe a month or so, to allow the reminders to sink in and the changes to be made, we can do a second questionnaire then to review how things have changed. The final stage is looking at procurement data, so to compare if orders of gloves and the use of gloves has changed in that time period. So you can email me direct, annettee@volunteercornwall.org.uk for all those resources and for us to come and support you and help with that. So far, like I said, 7 GP practices have expressed an interest. We've had 2 that have completed the first questionnaire and the training. All the feedback has been positive. So we're really hopeful that this will spread and more practices will do that. There is some learning each time. Obviously, we complete this with GP practices. There's learning we can take from that and to feed in and change the training as necessary. So far, so good. This is part of the NHS Southwest Peninsula ICB Green Plan that was adopted in October last year, and it's part of that commitment to reduce environmental impact. And it's also seen as one of the top 10 easy wins from NHS England. So gloves are on here. There are other things. So we've decided to start with gloves. It seemed like a popular choice, and people were ready to engage with it. But it could be something that we revisit with things like couch roll or looking at the disposable aprons that are used. So yeah, any ideas, any thoughts about this? And learning, please get in touch. Even if the practice isn't willing or isn't able to do the training and the full pilot with the questionnaire and so on, if you've got learning, maybe you've done it in a different way in the past and you've found it's working really well and you don't need the training, but all of the feedback that you can provide to us as a team would be really, really valuable. So please do get in touch if you've got any learning about glove use. So the next thing I want to talk about today is our waste and recycling resources that are on our website. So there's our website. I say new website, but it is about a year old now, but we are still building it and still adding to the resources section. So what I'm going to do is just quickly show you and take you to the resources section. And if I just make that screen larger. So we've got definite groups of resources, including Waste Watchers, but you can just click on this Browse All Resources and search for whatever you're looking for. We've created a Waste Watcher, so you can go and scroll down through and look at any of these. There's lots of posters on here. If you've done the Green Impact for Health Toolkit, you may have gone on and downloaded some posters that you might want to use. So those are all there. And then we've got the recordings from previous Waste Watchers meetings on here as well. So just wanted to show you this as a resource and let you know that you can search for any resources on here. So if you're looking for example, well-fed or toolkits, if you're looking at green spaces, then you can do that. But if you just go to Browse All Resources, and then you could put in a keyword, for example, waste, that's another way that those resources will come up. So there should be plenty there. If there's a huge gap, if there's something that you have used and you think, oh, that would be really good to share with other people, please do share with us and we can get it on the website. So that's resources. Next topic is blister pack recycling, which has come up again and again. So just wanted to do a little bit of a recap and also reach out to see what people's latest experience has been in terms of how easy it is to recycle blister packs, because we do hear anecdotally, it would be great to hear a little bit more from people about what's going on. Mainly patients, I hear about they find it hard to recycle and know what to do with their blister packs. So they fit into, because blister packs are obviously mixed type of material, they fit into the hard to recycle category. So you can't just pop them into any other recycling. So you can't put them in your home plastic recycling because they often have that foil back. So they need to be taken to a different place. So there's a couple of places that have in the past been sort of regulars. I was taking mine to Superdrug for a long time, but now there are lots of stores have closed and there are very few that accept the recycling in Cornwall. As I understand it, and please do get in touch and correct me if I'm wrong, the only Superdrug stores that will accept the blister pack recycling are those that have a pharmacy within the store. So I think Truro is the only one that I know of in Cornwall. There may be St Austell as well, but you can check online and the other big retailer Boots have got blister pack recycling, and it's quite a long-winded process if you want to get Boots points. I think you might be able to just go and drop off your blister pack recycling in Boots stores without going through that process. But if you want to use your Boots Points Club card, Boots Club card to get points, which means that you get money off things in store, then it is a little bit of a fiddly process, but it is still, as far as I know, working and possible. So I wanted to introduce the idea of a couple of other options that can be done by other organisations. So this could be done as a practice, could be done as a community hub, could be done as any sort of organisation that is willing and looking to invest in this sort of recycling. So TerraCycle is one of the paid for services. There are a couple, but TerraCycle is the first one here. So you pay about £100 for a small container for blister packs. That contain you can fill that with about 1,500 blister packs. That's the smallest. You can there's a couple of different sizes. The most expensive one is 216, and that can take about 7,500 of the empty packs. So they do a video, they have got a video online, explains what happens and how they recycle. So it's really good to see what they do with those blister packs that are sent to them. There's another option at Refactory or My Group. They have a slightly cheaper option, and they quantify it in a different way. So they talk about litres. So the Refactory My Group, the experience that we've had as a team in the past, we've had them. We had some funding available, and we had them sent out some GP practices. The ones that were most successful in that pilot were the ones that were kind of carefully managed and were, I think, most best used, easily filled up, were when they were in waiting rooms so that patients had access to them. But we have had some experience where if cleaners aren't informed fully, then they sometimes get muddled up and empty the blister packs in with the other recycling, which obviously is not not recycled in the best way. So those two options, either Refactory or TerraCycle, are paid for options. So it's about who's going to fund that, and that's something that we're always willing to explore and looking for opportunities to do that. So we'll be in touch if we are successful with any of our funding applications. But both of those, you have a container. When it's full, you get in touch with the organisation, and then they come and collect it, and that's included in the price. So you can look into those two options. My group is based in the UK, based in Leeds, and they use the plastic that they get from those blister packs to be made into alternative materials. And some of the pictures are shown here. Quite often it's used for outdoor boxes and outdoor furniture. So you can view on their website a lot more information about the materials you can that are made and the goods that you can buy from that are made from all the recycling. So please get in touch if you've got any experience of using either of those services or any of the other services, or if there's something that we haven't spotted. We're always keen to learn and share. Or if you've still got one of those refactory boxes in your surgery and you're not quite sure what to do with it, please get in touch. We can support and help if you don't want it anymore, or we can make sure it's recycling is collected. So that's the end of the what we're going to talk about today. The next meeting is on Tuesday, the 15th of September at 12:30, another online meeting. And there is at the moment no topics on the list. So please get in touch if you've got any ideas or anything that's come up in your practice that you really want some support with that relates to waste and recycling. My email's there, get in touch, but we'll stop the recording now and see you next time.